Warm greetings to you all. This is Tony Fauci here, and it gives me great pleasure to have the opportunity to congratulate the Massachusetts General Hospital for 200 years of service safeguarding public health. It is hard to fathom just how many things have changed since the first patient, a man with syphilis, came through the doors of your institution back in 1821. At that time, the field of medicine was still in its infancy. Since then, numerous foundational advances that have formed the backbone of modern medicine have been pioneered by exceptional physicians, nurses, healthcare providers, and scientists, many at the Massachusetts General Hospital. These breakthroughs have paved the way for physicians and healthcare providers to deliver state-of-the-art treatment and patient care in support of public health. As director of the National Institute of Allergy and Infectious Diseases, and as an infectious disease physician and scientist, I would be remiss not to acknowledge the extraordinary contributions of the Massachusetts General Hospital to our understanding of infectious diseases. When the esteemed Dr. Morton Schwartz established the Infectious Diseases Unit at Massachusetts General in 1956, it was a unique time in the history of the impact of biomedical research on the discipline of infectious diseases. At about around that time, the advent of antibiotics, vaccines, and public health measures had led various health experts and pundits to opine, believe it or not, that the threat of infectious diseases was nearing an end. Unfortunately, they could not have been further from the truth. Little did we know that the very first embers of HIV were beginning to simmer, leading into a pandemic that would transform the globe. Today, as we stand looking back on how much has been accomplished in turning HIV into a manageable chronic disease, I can reflect with gratitude on decades of extraordinary research and discovery, including at the Massachusetts General Hospital. Foundational work from so many of my esteemed colleagues, including Drs. Martin Hirsch and Bruce Walker and their multiple trainees, have been integral to our understanding and treatment and prevention of HIV. Of course, in the 40 years following the initial recognition of cases of AIDS, we have seen dozens of diseases emerge. Indeed, the past 12 years alone have brought H1N1 swine influenza pandemic in 2009, chikungunya in 2013, Zika in 2015, and multiple outbreaks of Ebola in Africa from 2014 to the present, just to name a few. Fortunately, infectious disease leaders, including Drs. Stephen Calderwood and Rochelle Walensky, have ensured that the Massachusetts General Hospital has been ready to respond to emerging and re-emerging infectious diseases threats. Most recently, the emergence of COVID-19 has presented the greatest pandemic challenge of the century and has been actually the worst in the past 100 years. For more than 18 months, COVID-19 has repetitively imposed crushing levels of stress and strain on medical staffs. You are among those who have faced these recurrent surges of COVID-19 hospitalizations with courage, resiliency, and adaptability. Thank you for your extraordinary dedication and expertise as you continue to not only care for patients, but also significantly advance research addressing the pandemic. I have had the pleasure of working closely on a daily basis with one of your own, Dr. Rochelle Walensky, as we address this public health crisis at the national level from a domestic and global perspective. And so, On this celebratory day of reflection, I express my unwavering gratitude to the leaders, physicians, nurses, and staff of the Massachusetts General Hospital. For 200 years, your institution has been an extraordinary hub of delivery of health care, teaching, and medical discovery. Congratulations, Mass General, for 2 centuries of remarkable accomplishment. I wish you all the best for the future.